A long time ago, someone made the comment that the Delaware Valley was to healthcare as cars were to Detroit. And there's that much healthcare and CCRCs in this area. And knowing that we're not only competing for residents to move in, but we're also competing for all the staff to take care of them, there was really a vacuum for a while of healthcare, trained, good healthcare workers. The CEFA partnership has really helped in providing a lot of different training.
A new clinician is coming in, and that's the patient care tech, and by having EKG and phlebotomy, it places these people that come through this program one step ahead to get those positions where they're in a hospital. And you know, the advantage is once they're in the hospital and once they have the background of a couple years under their belt of patient assessment and learning about patients and interacting with patients, then they can take advantage of programs at the hospital where tuition reimbursement to go on become nurses or respiratory therapists, whatever they choose to do. The point is, the whole world opens up to them they never realized was there.
Just a small part of learning gets them to realize this is a profession and that lifelong learning and continuing their education will help them move up and achieve greater success in the profession.
My desire is I want to go in to be an LPN, but I thought I really would like to take the phlebotomy class. I wanted to take this. I felt like if I can do okay with both of them, then okay, I'm getting older, but I probably can handle that too. But I have to find a way to do it. For sure. So, yeah, I just, so I'm going to keep working and working hard at learning new things.
Some of our leadership that has gone through the certification course, one individual in particular, I think initially when he got ready to take the course, he's been doing this now for in excess of 30 years. Many people thought that that person was going to be resistant to doing it. Like, I've been doing this for all this time. Why do I need to go back to some class and take this exam I got to study for all these hours? He was one of the first persons that came back and said, you know what, thank you. Because I've been doing this all these years, and for various reasons as to why I hadn't been able to do it, I'm excited now that I can say now that I've taken the time to be certified and that the hospital has shown me that they do value what I do enough to take the time and to put the financial resources behind it to allow me to be able to enhance what I do every day.
A lot of different people, individuals, benefit from this program, coming from really nothing to have stories of maybe the first time that anybody in their family has gone to college or taken a college course, the pride in accomplishing something. There's just so many benefits that have come from this that you can't put on a scale, you can't put in a graph, you can't build a pie chart and say this is what it is. But maybe on an emotional level, to be able to see the people that have come through the programs that have been offered and just see the self-esteem that's building up. On a personal level, that's one of the things that I go for.
CEFA meetings bring together all different stakeholders of the healthcare industry in southeastern Pennsylvania. So whatever type of business that you're in, you're going to be able to connect and partner and share best practices. Some of the discussions we've had at meetings have been very eye-opening on how other people are doing things at their facility. It also gives a commonality of the concerns and the gaps that we need to fulfill the training needs in the industry.
And I think that the partnership is that you're able to bounce ideas off, you stay current with ideas, you're able to bring the current trends that are going on and be able to work with them.
You know, part of being part of the partnership is you are part of a community, so issues you're struggling with at work, you come to a CEFA meeting, you're in the same boat as everybody else, so it's a really great sense of camaraderie and community.
I would just say to anybody that may be seeing this that may not be a partner with CEPA now or considering to be a partner with CEPA, to definitely consider doing so. In today's day and age, and particularly in healthcare, there are numerous opportunities for us to try to enhance what we do and do a better job of it. And we all are looking for different ways that we can do so and do so in a more meaningful way. And I think this is by far one of them.
You know, don't hold yourself back. Don't allow anything else to hold you back. Get in here and do it.
It has been tremendously valuable, and I'm excited to be able to hear and see what's the next step.